Hello and welcome to HealthWatch. I'm Dr. Vince Glielmi. On behalf of the physicians and staff at Everett Community Hospital, I'd like to welcome you to this segment. Today we're going to be talking about female sports injuries, and we'll be right back after this segment. And welcome back to HealthWatch. Today we're talking about female sports injuries. Our guest, we have Dr. Joy Long of Lancaster Orthopedic Group. Welcome to the session. Joy, just to clarify, you've actually done some special training as it relates to sports medicine, and maybe elaborate on that. How did you get interested, and what was your training?
Well, I did a fellowship, which is an extra year of training at the University of Michigan in sports medicine and shoulder surgery, actually, and I got to work with a lot of the athletic teams there. I worked with the football team as well as women's gymnastics, women's basketball, so it was a good experience.
Great. And in particular, interested in sports medicine, I guess, as we look at our population now, a lot more, particularly young people are playing a lot more sports, and particularly women. Yes. And our topic today is germane to that. I think we're going to be discussing the female athlete and your particular expertise in that. So let's just talk a little about that. It is true, I guess, that more women are playing sports and they're doing it younger than they ever did before.
Absolutely, absolutely. I think that part of what brought that on was the advent of Title IX, which said that colleges had to offer the same athletic opportunities for women as men, and that just has trickled down over the past 15, 20 years, so that now you see just as many kids playing soccer, 5-year-olds playing soccer that are girls as boys. So I think that has really made a big difference in the increase in women playing sports. Yeah,
certainly a lot more organized sports. I mean, I have grandchildren now, and even the difference between my children growing up and then watching my grandchildren up, and it's almost a push to have them involved in sports, and which is a good thing. We want them out, but it also creates some issues, and particularly for the women. So, there is a difference between how a woman responds to sports and men, and maybe elaborate upon that.
Well, I think you're exactly right. And at first we thought that, women and men with sports injuries were the same. But over the years, especially, honestly, tracking in the colleges, because that's where a lot of the data comes from, we've found that there are definite patterns to injury that differ between women and men. And some of these are based on the sport itself. So you may find more shoulder injuries in swimmers, and you will likely find more ankle injuries in gymnasts. But some of it is also related to gender itself. Women tend to have a higher likelihood of having what we call ligamentous laxity, which is loose joints, which can predispose to ankle sprains, knee pain, shoulder issues, depending on the sport that they're playing. Women also have a different type of change in their bodies as they go through puberty, whereas a male puts on more muscle mass and become almost leaner going through puberty. A female actually puts on more fat and her hips become wider, making a lot bigger change in her center of gravity as she goes through that time in her life. And so we definitely see different injury patterns in that time period and then beyond.
Yeah, is it, and taking that theme, is it to puberty that we have to worry, after puberty we worry about it, or is it really start at, I got grandchildren playing soccer and alike, and they're out there with boys and alike, and is there a difference between that age group to 13, or is it really start in the younger age group?
Some of the things are more common in girls. The ligamentous laxity you may see very early on in a 7 or 8-year-old, but a lot of the issues, for example, with ACL injuries, which we'll talk about later, are much more prominent when you're talking about a pubescent girl, right, or a teenager.
Right, and the ligamentous, those types of things is a function of just the difference you talked about, body habitus, but are there the hormonal issues that these people go through and alike, and creates issues unto themselves?
There are. So the hormones related to the menstrual cycle actually do cause all of the ligaments in the body to loosen slightly or become more lax at certain points during the cycle. That's because they're the same hormones that are present during pregnancy that allow the pelvic ligaments to expand to allow the baby to come out.
Sure.
So they're obviously present to a much less extent during just menstrual cycles, but they're definitely present. So there's been actually studies that have shown that, for example, ACL injuries are more likely to occur at certain points during the menstrual cycle. So that definitely does play a role for girls, and obviously not boys.
Okay, good. And I guess the question I've asked of some other orthopods when we've talked about sports injuries, and particularly in men, is the repetitive sports, using one sport as opposed to multiple sports in your children. We all want our kids to be college bound and get a scholarship for X, Y, or Z, or end up as a sports hero. That doesn't happen majority of the time, and yet they sometimes will single out a sport to be in. Is there a difference between different sports, and how should we look to that?
I think it's much healthier, especially for the younger children, to be involved in multiple sports, or if they only like one sport, to be playing that sport for a season. Because if you are playing the same sport year-round, you're putting the same stress on the same joints over and over and over again, and you're much more predisposed to an overuse type injury. And you have to remember that especially the younger kids have growth plates. They are still growing. Their bodies are changing constantly, and you need to allow that growth to happen normally. And by constantly stressing the same bones, the same tendons, it's not exactly healthy. On the other hand, if you have a child who swims all summer and plays soccer in the fall and basketball in the winter and baseball in the spring, yes, they do need a break from sports. And I like to say that you should have a day off a week, every week, from your organized athletic activity. And if you are in a high school student type situation where you're more specialized, and this is a star soccer player, and we're going to have camps and summer leagues and indoor leagues, you really should have at least a month off during each calendar year where you're doing something else, some sort of cross training where you're not putting the same exact stresses on your body. Because I've certainly seen the high school junior or senior who's been playing just soccer or just baseball or just gymnastics for the past 6 years without really any break, and now they have so many overuse injuries that they're not as competitive as they could be.
Yeah, the other downside to that. I think that's a judgment call. I've just seen parents that are so competitive themselves, and they see their children, and they're really pushing them. And I've seen others that actually said, I've had enough of that sport. They've done it for all this time. I don't want to do it anymore. I want to do something else with my life. So I think it's a balance that everybody has to achieve, not only physically but psychologically for these children as well. I'm going to throw you a curve, because I didn't talk to you about this beforehand, but there are some sports that women should just not be doing. And I guess that's a point of controversy, but football is one. And I think we're seeing some women now, or girls that are trying to get into sports, and are there, I'll just ask your opinion, there's particular issues, I think, physically. I'm not opposed to anybody if you're capable, but physically there are issues, I would imagine, that come to bear.
Yeah, that's a hard one. I mean, there's certainly girls and high school girls in this county who are on the football teams, usually as kickers, and I think that's perfectly fine. There's no reason that they can't participate as a kicker. I think if you're talking about an all-girl football league where the women are playing against each other, I don't think it's necessarily problematic, as long as the equipment is appropriate and it is protective. However, the problems you get into is when you're talking about co-ed, and especially beyond puberty, male athletes just have more muscle mass and have more strength per size than a female athlete does. And it's not chauvinist, it's just the way it is. It's the facts of life. And so if you're having women play against men, they will tend to get injured more frequently.
Yeah, intuitively you think that. Apologize for the curveball, but hey, we got to take a break. We'll be right back after this message. And welcome back to HealthWatch. We've been talking to Dr. Joy Long about female sports injury, and I guess when we left, we talked about again, some of the differences, things that we know they're singular to women. And I always knew that some of the athletes, particularly women athletes who are in cross country and those types of high energy places that have menstrual irregularities. I think we've talked about that with some of our OBGYN, but I'm not sure I realized that that actually could cause some bone injury. And maybe you want to elaborate upon that.
Absolutely. Over the past several years, there's been the concept of a female athlete triad, which is low bone mineral density, inadequate nutrition, and menstrual irregularities. And when those three things are present in the same athlete, there's an incredibly high risk for stress fractures. And the reason for this is that a lot of our female athletes who are endurance athletes, who are in sports where they run a lot, they have a very low percentage of body fat. And if your body fat percentage is low enough, then you don't menstruate. If you're not menstruating at a certain point in your life as a female, you're not producing as much estrogen, which means that you're not putting as much calcium into your bones. So even if a young girl is consuming enough calcium in her diet, which actually is pretty rare, she might not be adequately depositing that into her bones if she's not menstruating regularly. On the other hand, there's also a lot of focus on slenderness in our society for young girls, and certainly some sports are more focused on that. So like cheerleading, gymnastics are very focused on maintaining a certain weight. And sometimes we actually even see this in male athletes as well, in wrestlers, because they're also very focused on maintaining a certain weight. And so sometimes it's a lack of nutrition, but there are times when there's actual eating disorders involved as well, like anorexia or bulimia, which is certainly something we watch out for. But then these things can lead to decreased bone mineral density because there's not enough calcium in the bones, and so you get stress fractures, which is basically an overuse injury. And I mentioned that a lot of young ladies don't get enough calcium in their diet. The recommended daily allowance of calcium for teenagers, and this actually starts at age 9. Age 9 through 18, the recommended allowance is 1,300 milligrams of calcium a day. If you drink an 8-ounce glass of milk, that's 300 milligrams. So these girls need a little more than 4 servings of calcium a day, and it's very rare that they're getting that. So yes, if they're really eating a lot of yogurt and cheese and drinking milk, then it's possible they're getting it, but otherwise they really do need to be taking a supplement, and it ought to have vitamin D in it to increase the absorption. Interestingly, your body can only absorb about 600 milligrams of calcium at a time. So if you take 1,200 milligrams of calcium with breakfast and think you're good for the day, you've probably only absorbed about 600 of that. So you need to at least split it up.
Yeah, I think the nutritional support thing is an important thing, having been a parent, and what you need to look out for with your children.
Absolutely.
Yeah.
Because stress fractures can really shut down an athlete. I mean, a lot of times if an athlete develops a stress fracture, it's a season ender, because you end up needing to rest that body part. Usually it's a lower extremity, a foot, a shin, a hip. The hips and the shins are the most problematic because they're more worrisome. If the fracture completes, it's a much bigger deal as far as surgical treatment. Sometimes foot stress fractures require surgery as well, but it's not quite as big of a surgery as a tibia fracture or a hip fracture. But sometimes it requires immobilization, sometimes with casting or boots or other types of things. A lot of these girls have to be on crutches for a while, and it can take several months for the stress fracture to heal. And so, you know, they'll lose a season for this, and it's an important finding. If I see a young lady with a stress fracture, I'm always going to ask her about her menstrual cycles and about her diet, just to kind of screen her for those other problems. And then I'm also going to be more alert if she's had multiple stress fractures in the past.
Yeah, and just as an aside, some of these can be really occult. I know they can come, and a lot of times they'll show up at your office with pain and it's not evident on a regular x-ray. With the capabilities we have now, what else would you do to diagnose them?
So a stress fracture, you're right, does not usually show up on an x-ray, sometimes for a month or more. So we usually have to get a bone scan or an MRI to find the stress fracture. And so sometimes a young person will present with foot pain, and an x-ray will be taken, and nothing will be seen, and they'll go back out and they'll continue running, and they just have continued pain and they think it's a sprain or a strain or some issue. Yeah. And those are sometimes the individuals who then come into the orthopedics office after going out and playing basketball and twisting their ankle slightly, and turns out they actually then cracked through a stress fracture in their foot, and now they have a complete fracture as opposed to just a stress fracture. So they are definitely important to recognize.
Something we need to become aware of. On the other end of the spectrum, you talked about the thin, non-menstruating female with, but are there difficulties that we see with women who in fact are overweight and are trying to play those kind of sports? Is it particularly associated with weight bearing and those type of things, or is it the same as men?
Honestly, I think that the weight issues are probably pretty global as far as gender. For stress fracture, I think it's going to be the same. Honestly, weight is a little bit protective for fracture because, like I said, the fat, a person's fat content or fat percentage in their body is related to how their menstrual cycles are. So a thin girl is much more likely to have irregular menstrual cycles, whereas an overweight girl is not. And also we've seen that, not related to athletes, but when we look at older women who have osteoporosis, it's much, much more common in the thin, frail-looking older woman as opposed to the overweight woman. Okay. And that's actually something that I tend to look to the mother. If the mother comes in with the child who has a stress fracture and menstrual irregularities, I'll turn to the mother and say, you should be getting a calcium supplement too, because what we've found is that calcium is only deposited in, or our bones only increase in density until we're about age 30, and that goes for women and men. After that point, we pretty much maintain the bone density that we've built during those 30 years of life. For women, then, after they go through menopause, they start to lose their bone density, and that's how women tend to get osteoporosis. Men, after about age 65, have a slower decline, but it's not as precipitous because there's no menopause issue. Yeah. But I try really hard to impress upon these young female athletes that their calcium intake is very, very important at this time in their life.
Really? That's a great point. And we're going to take a break now, but I think that's something we need to stress, that we learned nothing else today, that be aware of that nutrition and calcium supplements, whether you're an athlete or not, in the younger individual.
Absolutely.
All right, we're going to take a break. We'll be right back. And welcome back to HealthWatch. We've been talking to Dr. Joy Long about the female sports injury. And kind of when we left, we talked about nutritional support and all those. I think, Joy, I know one particular interest you have is knee injuries in the female athletes, and they seem to be an issue. Talk to me about that, particularly about ACL injuries.
Right. So one of the things we've noticed as we've been tracking injuries, particularly in collegiate athletes, is that there's definitely a much higher rate of ACL injuries in female athletes playing the same sport that a male athlete is playing. The International Olympic Committee also did a study. If you're talking about high school level athletes, there's a 4.5 times higher rate of ACL injuries in the girls than the boys. Wow. When you get to collegiate level, it's about 3.5. When you get to the professional level, it's pretty much equal. So we do see a trend towards equalization as the athletes become higher level. Whether or not that's a weeding out type process, the people who've already torn their ACLs are no longer playing professional sports,
that's true.
Or whether it's just a matter of conditioning is a little bit hard to say, but it's definitely a very distinct issue. And some of it has to do with just anatomic differences between women and men, especially after puberty. Women tend to have wider hips, and they tend to have a more what we call valgus position to the knee. Valgus is a medical term for knock-kneed. And I think I brought a slide to show this is
we'll show that now.
Particularly prominent when you watch a person jump from a stool or something. And so this is a girl, young lady in my office who's jumping, and she's showing the difference between jumping with and landing with your knees together or your knees straight, and you can see the valgus are incorrect and the correct way to land. And this is something that can be taught. And the other component of what we call ACL prevention programs or ACL injury prevention programs, which have been developed, is a focus on core stability, which has become very important. And the other slide that I brought is the same young lady showing us a single leg stance, which is a very simple way to look at someone's core stability. You stand on one leg. If you have to shift your weight over that leg to maintain your balance, then your core muscles are not in good tone. If you're able to maintain your body in a straight position with your torso over that one leg, then that's good core stability, good ab strength. So there's been the development of these exercise programs that are basically warm-ups for athletes to perform before, say, their soccer game or their practice, and they've shown up to a 70% reduction in what we call non-contact ACL injuries, which are the ones that you can work on. Obviously, if there's a collision and everyone's, knees are colliding and everyone's falling down, it's a little hard to protect yourself against that kind of a situation. But a lot of ACL injuries occur with a simple landing. A basketball player comes down awkwardly from a layup by landing on another player's foot, and she twists her knee and it buckles, and she's torn her ACL, and her season's over. Because unfortunately, you cannot perform any kind of cutting, running, jumping activities without an ACL, without your knee giving way and potentially injuring other structures inside your knee.
Yeah, I should stop you there because I always assume some things that we shouldn't, but the ACL actually stands for anterior cruciate ligament. And
Sorry.
And why is it such an important ligament? I guess we should mention that.
Well, it's the ligament that helps to prevent the tibia or the shin bone from shifting forward on the femur or the thigh bone. And you do not need an ACL for everyday activity. To walk up and down the stairs or to go to the grocery store or to ride a bike, you don't need an ACL. But if you're going to jump, you're going to sprint, you're going to pivot on that knee, you need an ACL. And the unfortunate thing is that it's not an injury that can heal itself. If an ACL tears and a person wants to continue with athletic type activities, they're going to need an ACL reconstruction, which is obviously a surgical procedure.
Right. To get back to the emphasis about prevention, I guess, and I think we don't do enough of that. But in fact, your theory is in fact that if we could tone these muscles up, get more core muscles, that in fact we can prevent a lot of these injuries, and particularly in a female athlete.
Absolutely.
Yeah.
And I think that's very important.
I think your statistics are interesting, though. I wasn't quite aware that there was that many more injuries in females as opposed to males with that particular injury.
And those are rates, obviously.
Yeah,
so
because of lesser
because there are still more males participating. But if you were to look at what sports have the highest percentage of ACL tear, college athletes, football is number one, but women's gymnastics is number two. And there certainly aren't nearly as many athletes playing participating in women's gymnastics as there are in football. But if you look at the percentages, that's the second most common sport in which to tear your ACL, and it's a big deal.
Yeah, no, it sounds that way, and I know, particularly with your aspiring to go on to more athletics in college and the like, it's certainly something you want to maintain.
Yeah.
We've concentrated on the female athlete as a younger age group, and I'd be remiss if we didn't talk about the people as they go through, their 30s and 40s, and all of a sudden, the female suddenly wants to play tennis or hasn't played tennis or wants to do even jogging and walking. Are there particular issues associated with that as opposed to the male that does the same thing once they go through menopause?
The stress fracture issue is certainly always more common in women than men, and a lot of these things are very similar in women and men. When someone is deconditioned and they go try to start an exercise program, they're prone to developing overuse type injuries such as tendinitis or muscle strains and things like that. I think that the issues with balance and valgus alignment of the knee is definitely still more common in women, and so throughout life you'll see that women are more likely to have these ACL tears and more likely to have certain knee problems such as kneecap instability issues or dislocating kneecaps and things like that. But certainly those types of differences don't change as you get older. The main things I would say would be the advent of arthritis. Knee arthritis is a little more common in women than it is in men, and so when women go out and start an exercise program that involves a lot of weight-bearing activity, they may find that they have some symptoms in their knees that they didn't realize were present previously.
Yeah, and you brought up the issue of the osteoporotic woman who suddenly wants to do athletics. We know that the spontaneous compression fractures, those type of things.
Absolutely,
you look for.
certainly. They call them fragility fractures, and stress fractures are definitely going to be more common if you have low bone density, and those are things, you know, that are a little harder to treat once the person has osteoporosis. But,
yeah.
Because it's harder to prevent them.
Yeah, and the sad part about that is it does create more immobility, and then it's kind of a spiraling cycle.
Yeah.
So, well, it's great having you here today. I think we need to come you back and talk about the surgical correction for ACLs, because I think it's a particular issue with females.
Absolutely.
Thank you for coming.
Thank you.
And thank you for watching HealthWatch.